Hello, everyone. I'm your host, Jackie Iverson. I'm the founder of Health Schema, the digital health wallet aimed at bringing personalized medicine as the mainstream practice by uncovering a 360-degree view of your healthcare journey so you can make informed decisions in partnership with your doctors and care providers. Part of the 360 of your healthcare journey, this podcast series feature well-rounded healthcare-related topics that are meant to elevate your whole health. Today, I'm so pleased to introduce you to my good friend Jean-Christophe Prin, otherwise known as JC, who is a classical Chinese medicine practitioner and acupuncturist in Fort Collins, Colorado. Hi, JC.
Hi, Jackie. Thank you for having me. It's a pleasure to be here.
Well, thanks for accepting my invitation. I'm really thrilled
Yep,
you're joining me and informing everybody about acupuncture and Chinese medicine. So I know how busy you are, so I'm really thankful that you were able to find the time to have this conversation with me. So, for a start, many people probably never heard about acupuncture or even Chinese medicine. So could you tell the audience first how you discovered acupuncture as a teenager? I love the story after you saw your grandmother's recovery. Tell us a little bit about that.
Yeah, so that's really what brought me into that field, clearly. And so I was 12 at the time when my grandmother was exposed to acupuncture. She dealt with the loss of my grandfather. And after that tragic event, she fell into a deep depression and she became catatonic. So it was pretty significant. She tried all the medication, and nothing helped her. And my aunt who was caring for her since my grandfather passed was heard about from her job, someone who knew about acupuncture and it's like, oh, you should try it because I think it works well for depression. So there was nothing to lose. And they tried this practitioner who became one of my mentors in France, in Nantes. And she slowly came back to life. And my whole family was completely stunned by how amazing she was unable to count or read, or she lost all those, cognitive capacities, and everything came back to her. So that's my first exposure to acupuncture and what made me want to study it when I became, an adult.
Wow. What a great story. And so from there, you were able to gain expertise and knowledge by studying in France first, I think at Institut Shenzhen, is that correct?
Institut Shenzhen, yeah.
Oh, Shenzhen, okay. In Paris. And then it took you to China and you ended up in the United States. So tell us a little bit about your journey. It's fascinating to me.
Yeah, so I studied in Paris for, the course of about 3 years and was exposed to what I like to call, we'll talk, I'm sure, about it later, acupuncture being a main word, but it has different ways of being trained, and so in France, I was exposed to what we call classical Chinese medicine. And then I did that training for about 3 years, and I ended up I wanted to be exposed to the culture, and see how it was practiced in China. And so I went there for about 1.5 years. And went to different hospitals and different departments at the hospitals. And I was able to, learn about the culture, the language, but also deepen my knowledge in Chinese medicine. And so that was a great exposure. It changed my life, clearly, and the perception I had from what I learned in France. But also there were some differences, which we can talk about also a little bit later. Mm-hmm. And then I eventually made my way all the way to the US, and I had to go back to school, so I had to restart my training. I couldn't transfer everything from my credits in France. And I went back to a school in Fort Lauderdale, the Atlantic Institute of Oriental Medicine. It was more of an approach that was called traditional Chinese medicine. So my training in France was classical Chinese medicine, but I didn't know it was just what I was exposed to at first, which is more... it's a more philosophical approach, and it's more classical. It's more based on the text, ancient text from the imperial dynasties. And TCM is more of an exposure to it's more standardized, and it's more institutionalized. And we can talk a little bit more about that too later.
Oh, wow. So that explains the difference between classical Chinese medicine and traditional Chinese medicine, which is usually the notion we hear more about.
Right.
So you probably found that in China, acupuncture is very integrated into medicine, right?
Yeah, so that's a good point. At the hospital I was in Jianqing, so it's the south of Beijing. It's a first teaching hospital, and the first floor was traditional Chinese medicine with different departments, cardiology, rheumatology, gastroenterology. And then on the second floor was Western medicine. So you could, depending on your income, because it was cheaper to be treated with Chinese medicine than it was with Western medicine, but you could choose and have an integration of both of them.
Wow, that's fascinating. I think we're kind of moving towards that a little bit based on what you told me about some cancer treatments.
Yes.
But what are the principles of acupuncture really?
So first of all, it's what I love about Chinese medicine. It's a holistic approach. So what we see more and more in the research in Western medicine as integrating the mind and the body, in Chinese medicine, it's always been obvious. Like there is no separation between the mind and the body and the soul. And so there's a strong component to that. And because of that, the body has its capacity to heal itself. And so that's what Chinese medicine is about. It's about supporting those innate capacity we have in us to move through healing, and improve many conditions. And so sometimes we get stuck in patterns. And Chinese medicine and classical Chinese medicine, herbal medicine or acupuncture can help move through those blockages and reinstate a better sense of health.
So you used to teach me that, there's wind, cold, heat.
Yep.
And what's the fourth one? I forget.
So you have 5 elements.
Oh, 5. Okay.
And so that's
air.
Part of a principle. So that's the first thing is being a holistic approach. Then you have you have many different theories. You have the 5-element theories with the wind, the water. So it's actually water, wood, fire, earth, and metal. So those are the 5 elements. Then you have the component of qi, which is the life force, right? And so the life force, that's how I like to translate it. It's energy, but life force makes more sense to me. And that's what moves through our body, our organ systems, the meridians, the pathways. So meridians is another concept. And then you also have the most important one, I think, is the yin and the yang. And so it's a symbol that everybody knows about, but it really embodies the complexity of a system of Chinese medicine and the opposite, the complementary functions and the connectedness.
Yeah, because it's all about balance, right? You can't have excess of any of the 5 elements. So that's why acupuncture's job really is to balance everything out so it's even and not excess or
exactly.
lack.
Well, sometimes there is going to be excess, so we have to release that excess and drain it. Sometimes there is going to be a deficiency, so we have to support it and nourish it, nurture it. Sometimes there is a blockage and a stagnation and obstruction, so we have to release that. Those are the main principles.
It's beautiful. It makes a lot of sense to me, to be honest with you.
Yeah, I think it makes a lot of sense to a lot of people.
Yeah.
Just that we're not used to those concepts. But sometimes when we can talk about some practical, concepts that or illnesses, and that's going to make more sense.
Yeah, what I appreciate, and by the way, you've been treating me for 17 years.
I know, right? That makes sense.
I started, of course, when I was just 10, right?
Yeah. We're still young.
And it made me laugh that you said, I've never heard you speak English before.
No, we are speaking French the whole time coming here. And I'm like, you speak very good English.
Yeah. But, I noticed that before you start any treatment with me, and in any case, and I know you do that with every patient, you spend time with your patients talking about what's going on in their life, and you want to understand their state of mind.
Yeah.
How does this analysis help you in being on point with treating the patient?
That's a good question. Well, when a patient comes in, you have different factors that plays out. Like the first time they come, they're in the waiting room, and you look at them. Just you look at their complexion, their posture, the way they present, and that gives you already information. So the intake starts as soon as you meet the patient, and then there is this intuitive piece that is developed when you in classical Chinese medicine even more so. It's an artistic approach and more intuitive. It's less fragmented, and so you just get a sense of what the patient is here for before they tell you about it. Eventually you almost kind of know what's going on.
Yeah.
And then they start talking about their, you have a family history, of course, and you try to look at the whole environment with the big piece of it is the emotional piece in Chinese medicine. And then their specific complaints, whether it's musculoskeletal, gastrointestinal, or, endocrinal. And then you try to ask about their diet, their exercise routine, all of that. But you try to get a huge sense, a whole picture again. It's a holistic medicine, so you want to get a sense of what their life is about, where they are struggling, where there is actually those deficiencies or weaknesses, where there is some blockages in their life, in their interactions with others or with their jobs, and how it plays out in their diagnosis or in the reasons, the elements that they are coming for.
Yeah. So the liver is the filter of the body. So there's usually a lot of problems with a filter.
It can be so many different
liver.
things. Liver, each organ is attached to an emotion. And that's why I said emotions play a huge role. And so the liver is attached to the emotion, for example, of anger and frustration, and irritability and resentment. So liver could be involved, but it can be many other, we're all different. Yep. Yeah. Spleen
kidney. Is what? Spleen is
spleen
stress.
is attached to the emotion of overthinking, overly worrying, be very, very mental and cerebral. And so too much of that, like anything, it's a balance, the yin and the yang we talked about. So too much of one thing will deplete the other. So too much thinking will deplete the spleen. And then as a result, we'll have a chain reaction that will lead to symptomatic issues.
Yeah, it's beautiful. You also look at the patient's tongue and feel their pulse.
Yep.
So what does the tongue tell you, and what does the heart pulse tell you about the patient?
So the pulse and the tongue are the two main, what we call a microsystem. So they are a reflection of, in a small piece of our body, like the tongue or the pulse on both sides, the radial arteries, you can reflect the whole body in those little microsystems. So we have other microsystems besides the pulse and the tongue. We have the ear, or the reflexology also in the feet.
Yeah.
And so
hands.
It gives exactly. So those two specific ones to diagnose in Chinese medicine, the tongue and the pulses, gives a lot of information to a practitioner about what kind of disharmonies and imbalances are happening within the body. And briefly, for example, on the left side of your left arm, the left pulse is more a reflection of your yin energy, your feminine energy, with how you sleep, so sleep quality, hormonal balance, and emotional balance. So those are more feminine qualities. And the masculine qualities on the right side, the right pulse, is more a yang quality with metabolism, immune system, the capacity to fight and defend your body, and your digestive functions.
Yeah. Speaking of ear acupuncture, what's the technical term? Auriculotherapy?
Yep.
No. Yeah.
You did.
I have a hard time pronouncing this one.
Auriculotherapy, that's correct.
So how does this type of therapy different than, the regular acupuncture, and how can it aid individuals who need, additional care?
So auriculotherapy is another macro system. So within the ear, you have a representation of the whole body. And so it can be complementary to body acupuncture. We can use additional points in it to support the treatment we are trying to have. But it's also very commonly used, and that's mostly well known for addiction treatments. But it can do much more than that. So there's a protocol that's been developed, and it's called the NADA protocol. So it means it's from the National Acupuncture Detoxification Association. That's what it means. And so you have 5 points that you use. You can use that for disaster relief, for example, with traumatic experiences also,
Wow.
or for addictions, as we talked about.
Mm-hmm.
And using 5 main points. So the lung, which is associated to the emotion of grief and loss.
Mm.
The liver, which is helping with emotional flow and balance and also detoxification.
Mm.
The kidneys is another point for detoxification as well. And then the autonomic nervous system to help with regulating the nervous system. And the last one is Shen Men. In Chinese, it means Shen is the spirit and Men is a gate. So it's a gate of the spirits. It's a point to help calm the mind.
Wow, you're so knowledgeable, and all this is also art. It's not just science.
That's what I said. Yeah, I agree. We call it a medical, art system.
Art of medicine.
It's art. It's
because
a medical art.
I mean, by training, when you were being trained, you learn to recognize different pulse sounds, different how it feels. I mean,
right.
It's difficult.
Yeah, and that's what I think. Another difference between the way it's taught, like we talked about classical Chinese versus TCM, traditional. They're very similar, but one is much older. Like as I said, it comes from the imperial dynasties 2,500 years ago. The other one is more since the Cultural Revolution in 1949 with Mao, with Zedong. And so those two approaches are different. The way you approach it in TCM is more pragmatic, and then the way you approach it, it's more of you have a lot of mentors, so mentorship is important, and you practice it. It's you have to check so many pulses, and that's how you refine those skills.
Yeah, is hands-on. It's
much more hands-on, and it takes a long time. It's a refinement that takes many years instead of just getting a degree here and then starting practicing. There is so much. It's a lifelong process.
Yeah. I mean, I always tell people not every acupuncturist is equal, because a lot of my friends, when I recommend acupuncture, they'll go, I tried it, didn't work. So I always have to tell them, I mean, somebody as passionate as you are, you're the best acupuncturist I've ever had had the opportunity to work with. And it works really well. So, I can vouch for if people can find a passionate acupuncturist like you are, that, they'll get a lot of help with that.
Yeah, it's like any providers. There are so many different, skill providers, and you got to be passionate,
right?
And
exactly,
do this job.
Exactly. But it's really amazing what you do. But what would you say is the most common ailment you treat people for over the years? Has it changed from early on in your career to now? Do you see a different aspect of what they need to be treated for, or has it been similar?
Yeah, I love that question. I mean, clearly with experience, you become more confident and you get more complicated cases. And so when you start as a practitioner, acupuncture is also, besides acupuncture being treating addictions with ear acupuncture, but people know it as, it helps for pain, pain management. And most people say, back pain, for example, it's going to hopefully be covered by Medicare. Still, the bill is still in process in Congress, but it's something that everybody knows acupuncture can help with pain. And as you become more comfortable throughout your career, you're going to start seeing different, more complicated issues and conditions. And, now I see patients with a lot of gastrointestinal issues, or patients who are doing cancer treatment and they need some alternative therapies to help with the side effects of chemo or radiation, or with peripheral neuropathy. All of those are issues that can be treated with acupuncture. And the more confident as you go through your career, the more complex cases you can treat.
Yeah, your knowledge is so amazing. I hope you're going to teach some people how to, hand down some of that knowledge that you have.
Well, I mean, many people who are passionate will have, a lot of knowledge, but it's just, that's what I love to do also with my patients when I see them, to try to explain to them what their condition, where they stemmed from, and how they can improve them on their own too.
But maybe you should start a school.
Why? There are many better teachers, better teachers than I would be. So
no, I'm not sure. But I hear of cancer patients who are undergoing chemotherapy or other therapies. They have side effects like nausea, fatigue, et cetera, et cetera. how can acupuncture help patients alleviate those side effects?
So yeah, you mentioned some, so nausea, fatigue, brain fog,
Yeah.
a lot of diarrhea also.
Mm-hmm.
It affects drastically the digestive system. And then peripheral neuropathy is another one that there's a lot of research out there to show that acupuncture can treat all those conditions.
Mm-hmm.
Nausea is definitely on the top of the list. And so a lot of the time, Western research doesn't understand always the mechanism of actions and how it works exactly, but they just know that it works really well, according to all the data and the literature out there. But acupuncture helps to, with nausea, we have a few sets of points like PC6, for example, and spleen 4 connected. So it's pericardium 6 and spleen number 4 on the foot, the opposite places. And they will naturally help to really dissolve and support the digestive functions. For peripheral neuropathy, we'll use local points and some distal points as well on the feet to help increase blood circulation, for example, and to help decrease, the numbness. But those are there is strong knowledge and data showing that acupuncture can really help those conditions.
Yeah, and you told me that hospitals started to integrate.
Yeah, I mean, even here in Fort Collins, at the Cancer Center, they do provide their acupuncturists who are, trained on staff that people can go see because if you don't have insurance, they can still access some of those care because as a provider, I cannot bill Medicare, for example. Elderly would have cancer treatments. But yes, on staff, they do have acupuncturists to help with all those conditions. And it's many other clinics, Cleveland clinics or at Mayo Clinic. I mean, they all have acupuncturists also on staff.
I love it. It's very avant-garde, but it's becoming streamlined.
It's finally, those two medicine, the modern medicine and those ancient art as definitely they are merging. And I think that's really the future of medicine.
Yeah,
so I don't have the same view, the same lens.
Right.
Don't look at it.
But I think they supplement. They
absolutely
complement each other, right?
We need both.
Absolutely. And for me, I think acupuncture works like magic. I remember coming to see you. I had a really, really bad cough and a sore throat. And after treating me for just one session, the next morning, my sore throat was completely gone. And my cough was completely gone too. I was blown away because, I usually do it as a supplement, but I didn't think it was really be the cure for me. So how do you explain this type of phenomenon?
So let's try to look at it through both lenses. We talked about these two different ways of looking at the body. So we can look at it first through the lens of Chinese medicine. We would call any infection or inflammation, like if you have, a sore throat or strep throat or, pharyngeal infection, heat toxicity. That's how we would call it. And then this heat toxicity will reside in different pathways or meridians that will go through the throat. So the main pathways that run through the throat are the stomach meridian and the large intestine meridian. So there are points on those pathways that would clear heat and release that heat and decrease that inflammation. They have also an analgesic effect. And so those points would be, sometimes we would blood lead them. So we would make a tiny little poke and then bleed a little bit, the last on your thumb and by your nail bed and index finger. And those would help release that through the blood, the heat toxicity. So that's on the Western, that's a very simplified way of saying it, but on the Eastern way of doing it. And then on the Western, there is actually a lot of published articles. There was this meta-analysis that I came across that was about 19 randomized controlled trials in a medical journal that showed that acupuncture for pharyngeal infections or sore throat was more effective than using antibiotics. And I was almost, at first I'm like, wow, that's crazy. But it's a meta-analysis of 1,700 patients.
Yeah.
And they came up saying that acupuncture was more efficient than antibiotics in those situations.
Amazing.
Yeah, I was blown away myself.
Yeah, I mean, I'm a believer because it worked for me. But also, when my son was 7 years old, I used to joke that I had to save his life every day because he was so hyperactive,
Yep.
a little stunt man. And I remember taking him to one acupuncture session with you, and for a day, just for a day.
Yeah, and he can make,
He was very calm, and I
nervous.
was blown away as well on how he can be so calm. But, what treatments are common for children? And what is there a minimum age for starting acupuncture?
Not really. Acupuncture, yes, sorry. I would say I wouldn't treat a young patient before they are about 8 years old. It's not always pleasant. So I would say when they are a little bit older, they're going to tolerate it. And they usually use just a few needles, not very few of them, but they respond really, very fast.
Yeah.
For younger patients, you can use only acupressure. I like to put little seeds, like you would use ear seeds in the ear, but you can put them on their skin, and the parents, or if they are old enough, they can also put pressure on those points, and when they come home, But also, I remember treating my youngest patient. Maybe he was like 6 months old and had, some what's
colic.
Colic, yeah, it was very colicky. Thank you. I was gonna say colitis, but it's not that.
Most babies.
Most babies are colicky, and it was 6 months old, had colics for at least 3 or 4 months.
Wow.
And nothing could help, and we did just honestly one treatment, and just using acupressure, and I never saw them again afterwards.
Wow.
I saw the mom, but not the kid.
Like I said, it's magic. I mean,
it seems like it's sometimes.
Yeah. And it's true. Actually, another point is people always think, oh, I don't want to do acupuncture because I don't like needles. But the needles, they shouldn't even be called needles because then that scares people away. But it's as thin as a strand of hair.
Exactly. You're right.
So, we should call it something else, not to scare people.
Yeah, I mean, they are hair thin, they are super thin.
It's not invasive at all.
No.
Although sometimes when certain points are really needed, you can feel a little bit.
They can, the stimulation, if needed, as you said, if there is an imbalance, which we are trying to reharmonize, there is an excess pattern, then the release of that excess life force or energy or blockage will cause some, a little bit of tingling or electrical sensation sometimes, or slight numbness. But it can be slightly uncomfortable, but it lasts, a split second or two at most.
True. And what about cupping? I know you practice that too. So tell us a little bit how it helps.
Well, cupping is part of, the system that's been existing for thousands of years also. And we see how it's been more, modernized. And you see it, with the Olympics with Michael Phelps. I remember seeing all this cupping, marks everywhere. Everybody was like, oh, cupping works great. And so it's been something that we've used for so long. And it helps to also, same thing, to decrease inflammation, to increase blood circulation, to break up some stasis mechanically almost on the muscle layer, the fascia, when things are kind of sticky. And so this can be very helpful for muscle, usually for aches and pains, but it can also work for kids with asthma. And you can apply the cupping around points on the back between the shoulder blades on points that are the lung points, and also ding chuang. It's a point that means it's treat asthma. And so you can do cupping on those points to also subdue those asthmatic responses.
Wow. I didn't know that. That's amazing. Asthma. There are a lot of people out there with asthma. So what do you love most about your job?
I love that you can, first of all, being around people, and being able to serve them and help them. It's always humbling because I always learn so much from their life, and it helps me, as I learn from their struggles and their, issues, illnesses, and, it just it gives you a different perspective on life. And, but I love how diverse it is, because I could see someone in the morning and I treat, nausea, and then the next patient will have migraine headaches, and the next one's going to have a sciatica, and the next one's going to have, depression and anxiety. So it's so diverse, so it can be overwhelming because there's so much knowledge to have and confidence to build. But eventually, it's never
monotonous.
Monotonous, exactly. That's a good word.
Yeah, I always say you saved my life.
Well,
It's true.
thank you. Well,
You are not allowed to retire, but lucky me, I'm a little older than you. So,
here we go.
um, so I always like to end the podcast and asking my guests what one success story. Do you have one to share that you've seen tremendous improvement in the person after treating them either with acupuncture or cupping or?
Yeah, there are so many, every day is like, I would say there are always little miracles. Actually my last patient had back pain I saw him once and he had back pain for a year after his divorce. That's, again, the mind and the body are so connected.
Right.
And with just one treatment and his back pain was about 50% better. So I was just my last patient before coming here. But the main, I think a good one would be, I remember this young woman, she was 19 years old. She was going to college and she had endometriosis and she's been having this since her first menses. And she's tried same thing, she's tried, of course, being on birth control and different modalities and even having surgery. None of it touched it, none of it helped. And I thought I was not going to touch it. I've treated patients with endometriosis, but not to that severity. And every time she came, she would just leave with no pain. Like she had 3 weeks out of a month of menstrual cramps and pain. And eventually, there was other psychological issues linked to it. There was also sexual abuse. So I think she was not aware of that. But the combination of the treatment we did with herbal medicine, which is plays a big role in menstrual cramping and menstrual pain.
Yeah.
And eventually by talking to her I thought there was definitely something else going on emotionally that was subconscious. So I suggested she saw a therapist at the university and between the two of those modalities, working in synergy, she was pain-free.
Wow. Within how many?
It took a while because, we had to go through the dynamic of the emotional piece, and bring it. I couldn't tell her right
to
away.
the surface.
I suspect that there is more to this.
Wow.
And she eventually became more open to it as we got to know each other. So I think it was over the course of 8 to 10 months.
Wow. That's still amazing progress considering she's had a lifetime.
She had a lot
of ailments.
Yeah.
So it is amazing. And I think it's great that you're so connected with the psyche of the patient and how it affects their body. I think it's amazing skill set, to be honest. But thank you so much. It's been amazing.
Thank you so much for having me. It's a pleasure to be here today, so honestly.
I mean, I've known you all these years and we've never really spoken in depth about this science. And even these conversations taught me so much. So thank you for taking the time. I appreciate you so much for everything you do for everybody and even for myself.
Thank you very much. And you're doing so much yourself. So, you should be very proud of all of the betterment you're doing in the world too.
Well, that's all, folks. Thank you very much, everyone, for joining us in this podcast episode of Health Schema. And I hope you were able to learn more about acupuncture and that you can also utilize this modality to supplement some of your other treatments that you may be going through. So you can get connected with JC if you're in the Northern Colorado area at jeanchristophe.com. So thank you and bye for now. Take care.